Alright, so hello everyone. Tatum and I are so grateful and excited to be here at Greencroft to present to you all again. Thank you for having us back. If you don't remember us, no worries. We'll start with a quick intro to reintroduce ourselves. Alright, so I'm Jazlyn. I'm a full-time dental hygienist with 5.5 years in the dental field. I began as a dental assistant and have worked as a hygienist for about 1.5 years. Both Tatum and I are completing our bachelor's degree in community public health through the IU School of Dentistry. And we're graduating this December, so super exciting. But here's a look at the people that mean the most to me. So in that top middle is my partner Bryce. He's very special to me. And then that's just a picture of me. And right below that is my sister Alyssa and her son Thomas. And then over there, my twin brother Jensen is on the bottom left. And then fun fact, my twin Jensen, my nephew Thomas, and I have the same birthday. And then in that bottom middle photo is Bryce and I with my best friend Alicia and my mom, and they've always been a huge support. And then finally, as you can see in the top left, I love traveling and being in nature. And thanks for letting me share a bit about myself. Tatum?
Okay, I think it's working. Okay, so I'm using this microphone so I can shut it off in case this little peanut starts to cry, so your ears don't bleed. So a little bit about me. Up there in the middle is my husband Lane. We've been married for about 5.5 years. We've been together since I was 13 in middle school. We both have a passion for hunting. That was one of his deer that he got last year. We show horses, ride horses, and then we just had our first baby end of September, and his name is Nash, and he is in my little carrier today, hanging out with everyone. He's about 6 weeks old today, so hopefully he stays quiet for you guys.
Alright, if you haven't already, fill out the pre-survey that we handed out with the green box around it. And then on the back side, at the end of the presentation, we'll have you fill it out again. Alright, so prevalence of dental infections. So today we're exploring an essential topic within public health, which is the prevalence of dental infections. So dental infections are a widespread issue affecting people globally with significant impacts on overall health and quality of life. This prevalence serves as a reminder that dental health is integral to our overall well-being, not just limited to our teeth and gums. Understanding the scope of these infections is the first step towards implementing effective preventative measures and recognizing the broad impact dental health has on systemic health. Throughout this presentation, we'll break down the causes, stages, and prevention strategies for common dental infections. So, as people age, their bodies undergo natural degenerative changes, and dental health is no exception. What we see is that degenerative dental issues, including infections, become more severe and complex over time. Older adults in particular are at a higher risk of dental infections. The reasons for this are multifaceted, which is medications, reduced saliva production, and a general decrease in immune response, make infections more prevalent in this age group. But it doesn't stop there. But it doesn't stop there. These infections can have systemic effects, potentially impacting heart health, respiratory health, and even increasing the risk of diabetes complications. In fact, studies have shown a strong link between oral infections and chronic conditions like cardiovascular disease. This slide emphasizes the importance of maintaining dental health throughout life, as dental infections can have far-reaching consequences beyond just the mouth. Alright, so among the various types of dental infections, cavities and gum disease are the two most prevalent. So let's start with cavities. Cavities, also known as dental caries, are caused by a bacterial acid that breaks down tooth enamel. If untreated, cavities can progress to infect deeper layers of the tooth, causing significant pain and even leading to abscess formation. On the other hand, gum disease or periodontal disease is an inflammatory condition that affects supporting tissues around the teeth. This begins with plaque buildup and can progress through stages from gingivitis, where gums are simply inflamed, to periodontitis, where this is severe bone and tissue loss. Both conditions are highly preventable with proper dental hygiene and regular checkups. Yet they remain prevalent, especially in the older population. All right, so we're going to talk about the stages of tooth decay. So tooth decay or cavity formation develops in a series of stages, each more severe than the last. So stage 1, it starts with white spots on the enamel, which indicate demineralization, an early sign of decay. Stage 2 is enamel decay. As the decay process continues, it penetrates the enamel, forming a cavity that weakens the tooth structure. Stage 3 is the dentin decay. The decay reaches the dentin layer beneath the enamel, accelerating the damage and often causing pain. In stage 4, involvement of the pulp. In this stage, the decay reaches the tooth's pulp, where nerves and blood vessels are located. This can cause significant pain and sensitivity, and the infection may spread from the tooth to surrounding tissues. And then stage 5, abscess formation. An untreated pulp infection may result in an abscess, a painful pocket of pus that forms around the tooth root. This can lead to swelling, fever, and even more severe systemic infections. And then stage 6, which is that very last one, is tooth loss. The final stage is where the damage is so severe that the tooth can no longer be saved. For context, nearly all adults aged 65 and older, about 96%, have experienced some level of tooth decay, and 1 in 5 have untreated tooth decay. These statistics highlight a critical need for preventative care and early treatment to prevent tooth decay from reaching these advanced stages. So we're going to talk about some signs and symptoms of cavities. Recognizing these signs and symptoms early can make a significant difference in treating outcomes. Some of these key symptoms to watch out for include a toothache, which is persistent or spontaneous pain that may occur without any clear cause, often indicating deep decay. We got tooth sensitivity, hot, cold, sweet foods, and drinks, which can signal erosion of the enamel. Sharp pain when eating or drinking, particularly when biting down or consuming sweet, hot, or cold substances. Visible holes or pits in the teeth. In some cases, cavities form the holes or pits, which can become more prominent over time. Staining, brown, black, or white stains on any surface of the tooth may indicate areas of decay. Pain on biting, which is often a sign that the decay has reached deeper layers of the tooth. And then these symptoms underline the importance of regular dental checkups and prompt action when any of these signs are noticed. Early detection allows for less invasive treatments and better preservation of natural teeth. Gum disease or periodontal disease progress in stages, each with increasingly severe consequences for oral health. So we'll start all the way down there on the left. Healthy gums in this state, gums are firm and fit snugly around the teeth. Gingivitis, which is that second one in yellow. This is the mildest form of gum disease, characterized by inflamed gums that may bleed easily, usually due to plaque buildup. At this stage, the disease is reversible with proper care. But once we get into periodontitis, it is irreversible. We'll start with mild. If left untreated, gingivitis can progress to the mild periodontitis, where the gums begin to recede and small pockets form around the teeth, trapping food and bacteria. Moderate, at this stage, the infection spreads deeper, leading to more tissue destruction and bone loss around the teeth. And then severe, the final stage involves extensive bone loss and tissue loss, which can result in teeth becoming loose and ultimately tooth loss. As you can see, it's kind of wiggly over here. Each stage of periodontal disease emphasizes the need for early and consistent dental hygiene practices, regular cleanings, and thorough oral care can halt or reverse the progression at the gingivitis stage. But as the disease advances, more invasive treatments may become necessary. According to recent studies, about 2 in 3 adults aged 65 or older, roughly 68%, are affected by gum disease. This statistic underlines the importance of regular periodontal care and maintenance for older adults, especially given the potential for gum disease to contribute to systemic health issues. Addressing gum disease early can lead to better outcomes and improve overall health quality in the senior population. All right, so we're gonna go over these two pictures. So as you can see, at the top is the healthy teeth. The gums are pink, firm, tightly hugging the teeth, indicating good oral health. Healthy gums provide strong support for teeth, helping to prevent movement and damage. And in the bottom image, we can observe the effects of periodontal disease. The gums are receded, which you can kind of see like right here. The gum tissue should be right here, and it has receded quite a bit, exposing more of the tooth structure, and they appear inflamed and very swollen. The tissue no longer provides the same level of support, which can lead to loosening of the teeth over time. This slide visually highlights how periodontal disease changes the structure and appearance of both the gums and the teeth, emphasizing the importance of preventing gum disease to maintain both function and aesthetics. Some signs and symptoms of gum disease. Recognizing the signs and symptoms of gum disease is crucial for early intervention and treatment. Here are some common symptoms: swollen or puffy gums, bright red or purplish gums, tender gums, bleeding gums. Gums that bleed during brushing or flossing are a sign of gingival inflammation. Pink tinged toothbrush. Seeing blood on your toothbrush is an early symptom of gum disease. Spitting out blood, bad breath, pus between teeth and gums, loose teeth, painful chewing, new gaps between the teeth, gum recession, change in bite. A gum disease affects the bone structure. It can alter how your teeth fit together. And these symptoms indicate that gum disease can progress significantly if left untreated. Early intervention can stop or even reverse these symptoms, which highlights the importance of regular dental checkups. All right, gum recession. So we're gonna go over these photos here. Gum recession is a common outcome of untreated gum disease. As seen in these images, the gum tissue has pulled back, exposing more of the tooth and even the root in some cases. This exposure can lead to increased sensitivity and makes the teeth more vulnerable to decay and damage. In the top image, you can see how the gums have receded, leaving a noticeable line on the teeth where the gums should be. The bottom image shows another example where the recession has left part of the tooth roots exposed. So gum should be right here, and it has receded all the way down to that point. Gum recession can be caused not only by periodontal disease, but also by aggressive brushing, which is one of the most common ones. So you don't want to brush too hard at the gum line. You want to do very light, and even just using circular motions with a soft toothbrush to prevent that recession. But it also is caused by genetics and even smoking. It's essential to address gum recession early on to prevent further damage to both the teeth and gums and to protect the overall health of our mouth. So, as people age, certain changes in the mouth make them more susceptible to dental infections. Changes in appearance and structure. With age, the structure of teeth and gums tend to change, often making teeth appear darker or more worn. The gums may also thin out. And we already kind of went over gum recession, but this makes it easier for bacteria to accumulate below the gum line, leading to inflammation and decay. Dry mouth is a big, very common factor. It's also called xerostomia. It's more common in older adults and can contribute to dental infections. Saliva plays a key role in washing away bacteria and food particles, and without enough saliva, bacteria can thrive. And then your brushing technique. Older adults may brush too hard, which can cause gums to lead to further recession, which we discussed. These changes highlight why dental care overall becomes increasingly important with age. Adjusting oral hygiene techniques and seeking regular dental care can help mitigate these age-related changes and protect oral health. All right, some risk factors. Several risk factors increase the likelihood of developing dental infections. These include decreased salivary flow, history of cavities, past dental decay may makes future decay more likely. Living in care facilities may reduce access to regular dental care. Without regular dental visits, issues may go untreated. This can limit low socioeconomic status. This can limit access to dental care and proper hygiene products. Non-fluoridated water. Fluoride helps strengthen the enamel, and without it, teeth are more prone to decay. Poor oral hygiene, if we're not brushing and flossing regularly. Gum inflammation and recession, plaque formation, tooth loss, and poor diet. A diet high in sugars and low in nutrients can accelerate decay. Taking medications, this is a big one. Certain medications reduce salivary flow and can cause gum overgrowth, which can increase the risks of infections. And by understanding these risk factors, patients and healthcare providers can take steps to reduce the likelihood of infections through preventative care, education, and lifestyle modifications. Here are some treatments for dental infections. Fortunately, there are several effective treatments and preventative measures to combat dental infections, including good oral hygiene, brushing twice a day, flossing once a day, professional dental care, regular checkups, allowing for early detection and treatment of infections, fluoride treatments, which strengthens the enamel and can help treat early cavities, avoiding sugary foods and drinks, reducing sugar intake minimizes the fecal bacteria that need to produce acids that cause decay. Regular cleaning visits, usually recommended every 6 months, but once we hit that periodontal disease, we go in for periodontal maintenances every 3 to 4 months, so we can help maintain that. Saliva substitutes, for those with dry mouth, saliva substitutes help maintain moisture in the mouth and protect against infections, which we'll talk a little bit about that later. But it's important to note that home care is extremely important in preventing dental infections. This includes brushing twice a day, flossing once a day, and being especially mindful to brush before bed. That's the most important time to do it. By integrating these practices into daily routines and scheduling regular visits with the dentist, individuals can significantly reduce their risk of dental infections and maintain better oral health. Use 3 fingers.
Sure, I've been around the block a few times, so this idea about being mouth healthy for life, it's nothing new for me. These are the originals, and I plan on keeping them that way, so you don't have to teach this old dog any new tricks. Yes, I brush every day, twice a day, thank you, and floss to clean between my teeth every day. And I see my dentist regularly. Smart, healthy stuff you should be doing all your life, but more important now than ever, because folks our age have a few more challenges. Like the medications you're taking now can have an effect on your oral health. Make sure you keep your dentist up to date on exactly what you're taking. And if you're like me, well, arthritis can be a bother when you're trying to brush. A larger handle can be of help, or a battery-operated or electric-powered toothbrush might make it easier for you. Okay. Maybe now there are some new tricks we can learn.
All right, so now we're going to move on to oral cancer.
If I stand over here, can you guys still see the PowerPoint? Am I in anybody's way over here? Okay, just in case I gotta grab a bottle. So kind of going into oral cancer here. So I wanted to start off with a couple statistics, just to kind of get your brains thinking here. So oral cancer represents 3% of all cancers diagnosed. It's 1/5 as common as breast, colon, and lung cancer, but it's also twice as more common than cervical cancer. There's over 30,000 cases of oral cancer that are diagnosed each year, and 7,000 of those cases result in the death of the patient. Oral cancer rates increase as we age. with the incidence rates being higher in men. It becomes more rapid after the age of 50. It seems to peak between 60 and 70, and the most common age diagnosed is 63. So what exactly is oral cancer? So oral cancer, just like any cancer, it's an uncontrolled growth of cells within the body. When we find oral cancer, we're gonna find it within the mouth, the throat, the neck area. The type of cell that is responsible for oral cancer is the squamous cells. Those are the flat cells that line the oral cavity. And then we also group this cancer within the head and neck cancers, and it can occur anywhere from the nose all the way down to your base of your neck. And then I have a little video here.
When you visit the dentist, your doctor checks for cavities and other dental problems. But did you know they're also looking for oral cancer? Oral cancer appears as a growth or sore that doesn't go away. It includes cancers of the lips, tongue, cheek, floor of the mouth, hard and soft palate, sinuses, and throat. And if it's not treated early, it can be life-threatening. Men face twice the risk of developing oral cancer as women, and men who are over age 50 face the greatest risk. In fact, it's the 6th most common cancer among men. There are many other risk factors, but one of the biggest is smoking or using tobacco. About 90% of people with oral cancer use a tobacco product. The good news is, it's not just your dentist who can check for signs of oral cancer. You can too. Conduct a self-exam once a month. With a light and a mirror, look around your lips, mouth, cheeks, tongue, and gums for any changes. And if you notice any symptoms like swelling, bumps, and rough spots in or around the mouth, velvety white or red patches in the mouth, unexplained bleeding in the mouth, unexplained numbness or tenderness in the face, neck, or mouth, sores on the face, neck, or mouth that don't heal within 2 weeks, difficulty chewing or swallowing, hoarseness or a chronic sore throat, a painless mass on the neck. Schedule an appointment with your dentist and healthcare provider. If any tissue looks suspicious, a biopsy can confirm cancer. Oral cancer can be scary, but if caught early, it is curable. Pay attention to any changes in your mouth, get regular dental checkups, and make some positive lifestyle changes to help decrease your risk. Remember, early detection is key.
This one curl is the
Okay, so I thought that was a really good video to kind of get some things on your mind. So I kind of want to break those down in depth and kind of go over them a little bit more slowly for you. So some causes of oral cancer, we've got smokeless and smoking tobacco products. That's your number one cause of oral cancer. Going down the line, we've got alcohol, poor nutrition, genetic factors, and chronic trauma. So then moving into some risk factors here. So as on the other slide, our number one risk is that tobacco use. So we've got chewing and smoking tobacco, drinking excess amount of alcohol, being out in the sun, as we know it can affect our skin, it can also affect your oral cavity as well. Being exposed to certain chemicals like sulfuric acid. A couple viruses here or infections, we've got the HPV and the Epstein-Barr virus. Those can also put your risk higher for oral cancer. Any kind of weakened immunity due to infections or certain medications. Consumption of processed foods like your meat and your fried foods. Immune disorders, and then certain inherited conditions of the blood. So some signs and symptoms to look for with oral cancer. So we've got white or red patches on the lips, gums, tongue, or the inside of the cheek. So the most common spot we're going to find this is going to be underneath the tongue or the sides of the tongue there. Any pain or difficulty swallowing, speaking, or breathing. Numbness in any area of the mouth that does not subside. Bleeding in the mouth from an unknown cause. So sometimes you can have bleeding if you're not brushing your teeth regularly or flossing regularly, but if you're having bleeding when you're just eating or breathing or you're waking up a little bit of blood in your mouth, that's something to get looked at. Possible lumps that can be felt within the mouth or the neck. So sometimes you can take your hands and you can feel around your neck and feel any kind of lumps there that are abnormal. Difficulty wearing any dentures. Possible hoarseness of the voice. So sometimes we lose our voice here in this season because it's the fall season, but if it seems to be happening more regularly, that's another reason to get checked. Loose teeth without having a reason. So if you wake up and your teeth are loose and nobody's come by and accidentally bumped you in the mouth, that's another reason to get checked there. And then sores on the lips or the mouth that do not heal. So something I kind of wanted to touch base that kind of resembles oral cancer, but it is not. We call these canker sores or aphthous ulcers. They're very common. So a little background about them. Everyone kind of calls them canker sores. They're these little white lesions that you can get in your mouth with a red ring around them. They're very small. Sometimes you get them on the inside of your lip, on your lower lip if you pull your lip out, or the inside of your cheek there. Some signs and symptoms of those, they're going to be a little painful, but the key point here is that they will heal within 7 to 14 days. So that's kind of one way we can tell whether we have a canker sore or maybe something more serious, is after that 2-week mark, if we still have that white painful lesion there, we need to get that checked out. Some causes of canker sores, when you have a weakened immune system, which is similar to oral cancer, you can get it that way as well. Certain foods, so like anything spicy can cause it. Increase in stress and a nutritional deficiency. And then some treatment here, so just try to manage your stress, which I know it's not easy to manage stress. Healthy diet, and then good oral hygiene. And then here's a couple pictures here of canker sores. So as you can see, it's just a white circle. It's more circular, and then there'll be a slide next that'll show oral cancer. You'll be able to see the difference there. But it really on that bottom lip there, if you pull your lip out, or sometimes up there along those top teeth, you can see it there as well. And then here's some pictures of oral cancer. So as you can see here on this tongue, it's more blotchy. It's not going to be your perfect circle. Down here, it's a little bit more of a perfect circle, but it's a little bit bigger. It doesn't have regular sides. This is the top of your mouth, your hard palate, so you can see it up there as well. And then we've got a couple areas underneath our tongue, and then this one is on the back by your tonsils. So this is how you can do an oral cancer screening on yourself. So when you're brushing your teeth in the morning and night, it's always good just to take a peek around to see what's going on in there. So a couple areas to mainly focus at. So you want to be able to pull your lips out. You want to look at the inside of your lips, top and bottom, along the edges of those teeth there. Another place you want to look at is your hard palate. So if you lift your mouth up, that gum tissue you can see behind those teeth, you always want to check that out. A couple other areas, the back of the throat. You can take one of those tongue depressors or a popsicle stick, kind of push your tongue down there, maybe shine a light if you have one ready. Just make sure the back of that throat looks nice and pale pink. Looking at underneath the tongue. So go ahead and lift your tongue up to the top there, take a peek under there, make sure there's no lumps or bumps or white spots. And then go ahead and grab your tongue at the end and move it side to side. You always want to check out the sides of that tongue as well. And then stick your tongue out and always check the top. So diagnosing oral cancer. So typically this is done by doing an examination with your dentist. So when you go in for those regular visits every 6 months for your teeth cleaning, most of the time your hygienist will find something that seems of concern. And then your dentist will come in and kind of clarify if it's worth having a biopsy. So if your dentist does have a concern, they can do a biopsy and then send it off to your lab and kind of get some results there. So some facts about doing a biopsy. They send it off to the lab. Sometimes a dentist will remove all of that white area if it seems to be pretty small. If it seems rather big, they'll just take a little piece of it, send it off for testing, and then if it's caught early, it can be treated effectively. So some barriers to receiving help. So some low knowledge of oral cancer symptoms. Oral cancer is one of the most common cancers, so it's kind of something that we kind of brush off to the side that we don't really realize that it's something that could be an issue. Kind of thinking of those canker sores. Sometimes you might think you've got a canker sore, but really it might be a bigger issue there. Lack of resources. So sometimes we're not able to go to the dentist's office to get anything looked at, or if we are diagnosed, we aren't able to get the help that we need. Fear or avoidance of dental offices. I get told almost every day that it's not the favorite place to be. I get that there's a big fear within the dental office, so that can be a barrier to receiving help. low income, and then no dental insurance. So then here's a couple resources. So we've got the Oral Cancer Foundation. They specify just in oral cancer, but they provide cancer organizations. They have a list of cancer treatment centers that you could go to. And then down here, the American Cancer Society, where they're more broad, they focus on all cancers, but they also do assist with oral cancer as well. They have multiple financial assistance funds available. They provide lodging to your appointments and transportation. So if you need help getting a ride to where you need to go or you need a place to stay, they're able to help you there. So some prevention tips. So always brush and floss your teeth regularly. That's gonna get your eyes inside your mouth so you're able to spot something. And that's gonna be twice a day, so you'll have 2 opportunities to spot anything if there's a concern. Don't smoke or chew tobacco of any type. Drink alcohol in small increments. Limit your sun exposure. So I know you know that can affect your skin anywhere, but if you think about it, your lips are on the outside, so that can affect your lips too. Choose healthier food options. And then see your dentist regularly, every 6 months typically is what we like to see. And then kind of going into another topic here to kind of finish out our presentation, we really wanted to talk about dry mouth. So dry mouth, that's where the saliva in our mouth is kind of decreased, and we have more of that dryness kind of feeling, especially when we wake up, it's kind of common then. So according to the American Dental Association, dry mouth is not a normal consequence of aging. So 9 out of 10 people over the age of 65 take medications, and more than 500 of those medications can cause some dry mouth. And those can also, those medications that we take, we use for heart problems, allergies, cancer, and anxiety. So some signs and symptoms of dry mouth. So you might have a burning sensation or sores within the mouth, some dry lips, bad breath. You might have a decrease or altered taste in your mouth. Recurrent mouth infections such as oral thrush, or that's going to be kind of like a yeast infection in the mouth there. Tooth decay or cavities, gum disease, and then difficulty speaking, eating, or swallowing as well. So then going into how does dry mouth affect the oral cavity. So when it affects our tasting, chewing, swallowing, and speaking, that's affecting our everyday life. So you want to be able to talk to your friend, you want to be able to eat the foods that you want to eat. When you have a dry mouth, it kind of makes those things kind of difficult there. We also have that increase of dental decay, so we're more prone to getting cavities. That saliva acts as a buffer. So that buffer is going to help line those teeth with those proper minerals to keep that bacteria down at bay. Demineralization of the tooth, tooth sensitivity, and then those oral infections. So some oral manifestations of dry mouth. So here's a couple photos here. They're a little blurry, maybe for the better. But so down here on the tongue, this is the tongue, I promise. It's a little cracked just from the lack of saliva. Over here in the middle, you can kind of see, we've got our upper teeth and our lower teeth. You can see how it's really receded. We've got some tooth loss there. So this would be an example of having that tooth decay from having low saliva in the mouth. And then there on the far left, that's the top of your mouth. That's what oral thrush or yeast infection looks like at the roof of the mouth. And sometimes this is really common too with dentures. If you're not taking your dentures out and properly cleaning them, you can get that bacteria in there as well. And then that's how your thrush can start too. So why is saliva important? So this protects against gum disease, tooth decay, and oral manifestations. It's going to make your swallowing easier. It's going to line that throat cavity with some lubricant to be able to swallow your food properly. Speeds up wound healing, sweeps away those small bits of food that feed bacteria. So after you're done eating, sometimes you get a little bit of food there. As you're swallowing, that saliva is going to help take that food down your throat. When we leave that food in our mouth, that gives that bacteria something to eat on, and then we can have an increased risk of having a cavity there. The saliva neutralizes acids that break down tooth enamel. So our saliva is that perfect 7 buffer that we like to keep it at. We don't like anything more acidic, we don't like anything more basic. So when we eat stuff, it kind of lowers that acidic in our mouth. When that lowers, that bacteria thrives and we can get a cavity. So that saliva really helps keep that at bay. And then it also repairs the teeth by remineralization. So we've got 2 components in our saliva. We've got calcium and phosphate, and those are super important for keeping our teeth nice and healthy. So some functions of saliva, so lubricant protection for that speaking and swallowing, buffering action, taste and digestion, maintaining the integrity of the tooth with those calcium and phosphate minerals in our saliva, and then antibacterial, fungal, and viral. And then some lifestyle tips for relieving dry mouth. So sipping on that water throughout the day. If you're like me, it's really hard to get a drink of water, so make sure that you have a water bottle by you. Just kind of take some sips. That's going to help replenish that saliva as you go about your day. Using lip lubricants, so your chapstick, whatever kind of chapstick you like. Chewing sugar-free gum, or any candy with xylitol. So xylitol is kind of a chemical compound. It's a natural sugar that stimulates the flow of saliva within the mouth. Avoiding any salty or spicy foods, dry or hard to chew foods. Avoiding that sticky, sugary food. And then any irritants such as alcohol, tobacco, and caffeine.
All right, we're going to talk about dental and oral health specific recommendations. To maintain good oral health, here are some key recommendations. Brush teeth gentle twice a day using fluoride toothpaste to strengthen enamel and prevent decay. Floss daily to remove plaque and food particles between teeth when brushing. Schedule dental visits at least twice a year. And this also includes your radiographs once a year. Use prescription strength fluoride gel, such as 1% sodium fluoride for additional decay prevention if recommended by your dentist. Treat any oral, fungal, or bacterial infections promptly to prevent them from worsening and affecting overall health. Here's some over-the-counter aids. So for those of you who experience dry mouth, several over-the-counter products can help alleviate symptoms and improve comfort. So a Xylomelt helps moisturize the mouth and stimulate saliva production. Act Total Care Dry Mouth Lozenges. It provides relief for dry mouth and freshens breath. Your Biotine products, gel, spray, and toothpaste is designed specifically for dry mouth management. Our mouth coat spray helps lubricate and moisturize dry tissues in the mouth. Oasis Moisturizing Mouth Spray offers long-lasting relief from dry mouth symptoms. These products can be used daily and are available at most pharmacies. Diet plays a big role in oral health, especially for those with dental issues. Opt for soft, high-protein foods like fish instead of tougher meats, which are easier on the teeth and gums. Choose tender foods such as chicken, soups, soft vegetables, mashed potatoes, oatmeal, ice cream, and pudding to avoid irritating sensitive areas. Use a sugar-free candy with xylitol, which can help reduce harmful bacteria in the mouth, which causes decay. Xylitol is an excellent option for maintaining oral health between meals as well. So we'll talk more about xylitol. Xylitol is a natural sugar substitute found in many sugar-free products like candy, gum, and mints. It helps reduce decay causing bacteria in saliva, making it a great choice for people aiming to prevent cavities. Xylitol also has benefits beyond oral health, as it can help fight off some bacteria that causes ear infections. Including xylitol in your daily routine, especially if you have dry mouth or are prone to cavities, can be a simple way to protect your teeth. So here's some nutritional labels. These are examples from products containing xylitol. When choosing xylitol products, look at the ingredient list to confirm that xylitol is the main component. All right, proper brushing technique. To protect your teeth and gums, it's important to use correct brushing technique. Here's an example of one of the most common techniques that is used. So you hold your toothbrush at more of a 45-degree angle. As you can see, the toothbrush is angled like that on the top, and then it's also angled like that on the bottom. That 45-degree angle helps get to the gums and to all the areas in the mouth more effectively. You want to use gentle circular motions on the front, back, and chewing surfaces of each teeth. Don't forget to brush your tongue or use a tongue scraper. I highly recommend a tongue scraper. I use it myself. It helps decrease bacteria, freshen breath, especially, and I've seen a significant difference with the tongue scraper because I feel like brushing your tongue with a toothbrush, yes, it helps, but it's also more effective to use that scraper because you're getting it out of there. Overall, this technique ensures that plaque is removed effectively without damaging the gums. It's important to brush for at least 2 minutes twice a day to keep your teeth healthy, and also flossing at least once a day. And then to wrap up, let's recap the key points about dry mouth. So characteristics, understanding what dry mouth is and how it affects oral health. Saliva's importance, recognizing the critical role saliva plays in protecting the teeth. Treating dry mouth, use lifestyle changes and over-the-counter aids to manage symptoms. Xylitol's benefits, incorporating xylitol products to reduce harmful bacteria. And then proper oral hygiene, maintaining daily brushing and flossing habits. Following these steps can greatly improve oral health and prevent common dental issues. And to maintain good oral health, here are some key recommendations. Brush teeth gently twice a day using fluoride toothpaste. I'm just kind of reiterating what we already talked about, but it helps strengthen the enamel and prevent decay. Floss daily to remove plaque and food particles between the teeth where brushing can't reach. Schedule dental visits at least twice a year. Use prescription strength fluoride gel, such as 1% sodium fluoride for additional decay prevention if recommended by your dentist. Treat any oral, fungal, or bacterial infections promptly to prevent them from worsening and affecting overall health. So these are just some of the resources that we used for our presentation over each topic. And then now we'll have you guys flip over your survey papers and fill out the post survey. We want to see if you learned anything from all of this, and we will collect those afterwards. We can also go over those answers as well once you have finished.